Assalamualaikum and good morning to my supervisor, Associate Professor Dr. Syaiful Rizal bin Abdul Hamid, and my panel today, Dr. Hasan bin Saleh. My name is Nor Abharina Aiman binti Abdullah from 3BTMI, and my matric number is B061810250. Today, I would like to present my final year project on a title, A Description of Six Sigma Application in the Healthcare Industry. First and foremost, I will be starting with Chapter 1, Introduction of my research. Health is considered to be an important determinant for the promotion of the physical and mental welfare of individuals worldwide. A good working healthcare system needs financial facilities, a well-trained and well-paid staff, sound policy and decision-making intelligence, and well-administered clinical facilities. Quality health services are required for improvement and health protection, disease prevention and management, reduction of unnecessary handicap, and premature death, and health quality for all. Next slide is about background of study. Lean Six Sigma is one of the strongest strategies in the healthcare sector as it improves mental healthcare skills that address critical needs in patient care and protection. In 2011, NARA said that the country is under increased pressure to post healthcare, protection and quality of service while reducing operating and financial costs. Ramani, Mavalanka and Finn in 2006 said Lean Six Sigma should be used to meet this target as a method to optimize market processes. Problem statement of my research is healthcare overwhelmed by efficiencies, mistakes, and restriction on resources. Lazarus and Nelly in 2012 state that an appraisal was published by the Institute of Medicine reporting that every year 98,000 people die from medical mistakes and stressing the need to increase efficiency in 1998. Delays in the implementation of reliable, efficient health treatment also undermine medical errors and variability. According to Bayon and Hemfer in 2014, an Institute of Medicine IOM study report that death from general anesthesia decreased to 5 million and surgical accident causes deaths in hospital between 44,000 and 98,000 patients a year. Then, research question. Here is the following research question is addressed in this research. The first question, what is the methodology in Six Sigma that should be used to minimize the problem in the healthcare industry? Second, how far the relationship between the process of Six Sigma and the healthcare industry? And third, what is the most significant Six Sigma in the healthcare industry? Research objective in answering the research questions. The key goals to be achieved by this research is starting with to analyze the methodology in Six Sigma should be used to minimize the problem in the healthcare industry. Next, it is to measure the relationship between the process of Six Sigma and the healthcare industry. And then, to investigate the most significant Six Sigma in the healthcare industry. Let's start Chapter 2 with the research framework. The research framework demonstrates the possible cause of action and the preferred approach to an idea. There are two variables here, like independent variable and dependent variable. The research framework dependent variable was the healthcare industry, then followed by the 5 independent variables that deals with a reduced waiting time before operation, reduced unnecessary laboratory testing, reduced overtime of hospitalization, improve diagnosis imaging, and reduce contaminated needle stick. I will move to the hypothesis of my research. To be honest, all of my independent variables have a significant relationship with the dependent variable that I have mentioned before in the previous slide. Next, research methodology of Chapter 3. I will start with the research design. In this case, an explanatory research design was chosen to be the theoretical framework established and intended by the scholar. The explanatory research design was important to examine the condition of the cause and effect relationship between the independent variable and dependent variable. Second point is data source. The data sources are the platform for the collection of secondary and primary data. Firstly, I use the survey to get the primary data by providing with the most precise first-hand information on the respondent. The respondents are asked to respond to the question prepared with some of the statements used in numerous independent variables for Likert scale. Then, I analyze the data relating to the subject of the research. Is a famous approach consists of collecting the secondary data that the scholars are using. In this case, I gain numerous information using secondary data, for example, by using Google Scholar. Third part is sampling design. I use probability sampling to make a preference of the sample to answer the investigation question. In addition, randomly approximately 300 questionnaires were distributed to the employees by Google Forms in the healthcare industry. The people who work in Malacca are the target population of the research. About a sampling technique, I choose the best approach for this study in a simple random sample. Last part of Chapter 3 is data analysis method. Based on the study, I use the descriptive analysis to distinguish the age, gender, education level, job position and duration of work experience among the respondents who is working in the healthcare industry. I also use Pearson correlation coefficient. It was used to evaluate the strength of the relationship between the variables. According to the Founders 2016, multiple regression analysis (MRA) is a tool for analyzing the strength and relationship of the effect between two or more independent variables. In this case, MRA helps to analyze all the 5 independent variables had the biggest impact on the dependent variable, which is the healthcare industry. Statistical package for the social science, SPSS, is a computer software that allows the complex data to be organized into ample diagrams and answers to the questionnaire. In this case, the demographic part was used as an empirical statistic to define in detail the data characteristics. So, that's all from me and my final year project presentation today. Thank you for lending me your ears.